Hello. Today, I am going to discuss the signs and symptoms of an important homeopathic remedy, sulphur or brimstone. Sulphur is the king of remedy, around which centers the whole material medical. It acts mainly upon the autonomous nervous system and through it upon the venous capillary vessels throughout the body. It mainly acts upon skin, mucous membrane, focal system, genitourinary organs, etc. As a rule, sulfur may be indicated in all types of chronic diseases when indicated by symptom similar, but occasionally it may also be administered when the well indicated remedy does not yield desired result. As for example, a patient is suffering from fever and has come to our clinic. The symptom complex clearly indicates rust. Rust is administered, but there is no improvement. Don't be irregular, my friend. In this case, you have to think that there is some hurdle in the way of cure, which is interfering the action of the indicated remedy. Here, you have to think quietly and you have to select any antisodic remedy which comes according to the symptoms severity and most occasionally it is that please administer one or two doses of sulfur as an intercurrent remedy and again to administer the indicated remedy, then the cure will must come. In this connection, it is it is contextual and also what to mention that our great master Hahnemann, after inventing and practicing homeopathy for about 50 years, found that in some chronic disease, the well indicated remedy does not yield desired result. This fact led Hahnemann to make research on this field. He made many observations. He made research and also deep study to overcome this problem. And he advocated that there are three types of miasm which are acting as an hinder in the way of cure. There are three types of miasms are soda, syphilis, and syphilis. Sulfur is the king of antisodic remedy. Another various antisodic remedies are also there in our material design. As for example, sodinum, plasticum, podium, etc. There are other important symptoms also for sulfur. The action of sulfur is centrifugal, that is, from center to periphery. It means that suppose the patient came to you and he describes that his problem has originated from suppression or some type of skin eruption by strong angle. That is, there are problems from which the patient is suffering from is arising from the suppression of skin living by external application. In that case, you have to select an antiseptic remedy and most probably it is sulfur. And the action of sulfur will bring the disease which was nourished in the interior by the action of ointment to the exterior, and the patient will be relieved from his suffering and the real care will take place. Another symptom of sulfur is the patient is dirty, healthy, does not want to get the patient is hot, but not but is not at all fond of the wood. No sense of cleanliness is there in the sulfur patients. They sleep once, even they sit in the dining table without washing their hands. The patient is dirty, thin. The patient is hungry about 11 a.m. and there is a sinking feeling at the pit of the stomach. The patient must do something at that. The skin and hair of sulfur patient will dry and dry. Standing in the most positions for sulfur patients. They cannot stand for a long time. Standing aggravates all the suffering in the patient. Diarrhea of sulfur patient is also too much important, very important earlier, in list earlier. And the urging of stool drives the patient out of bed and he is compelled to go to the washroom. As soon as he makes one sleep, due to the extreme desire. Sulfur patients are very lazy. They do not want to do any hard work. They always want to lie down. Catalepsy. Their sleep is not at all sound. No deep sleep is there from the patient. A slighted sound awakes the patient. And so the patient when happy they sings and laughs in the sleep, during sleep. So the patient try and uh, so the patient sings and laughs. In this condition, the stomach symptom to be mentioned here. So the patient is fond of sweets, very fond of sweets, as is Argenta nativa. And intolerance for milk, cannot tolerate milk. Urinary symptom. The patient has frequency of illumination, value moisture, which lasts long originating. There is also nocturnal inhibition in stuffiness or tuberculosis and unsteady patients. Sulfur skin symptom is also would be to mention here. It has neural, papillary, or pustular eruption, which with intense burning, itching, and curling after stretching. The skin looks dirty, filthy, like dry, and the burning is aggravated or worse. Hand said the skin symptom is aggravated due to warmth or pain. Sulfur patients are stoop shoulder, stands, and sits, leaning forward. Discharges are expirating and pill. This is a very good medicine for beginning of chronic cases and finishing acute point. Now, turn to modality circulation. Clothes at place when standing 11 a.m. and by 1 p.m. Washing also aggravates suffering. Check. And better dry and one way. Thank you. Thanks. Have a good